සුබ දවසක් හැමෝටම. අපි අද පටන් ගන්නනේ ෆාමසි එක්ස්ටර්නල් කෝස් පේපර් ඩිස්කෂන් එකේ 10 වෙනි පේපර් එක. ඔයාලට මොනවා හරි ප්‍රශ්නයක් ආවොත් මට WhatsApp message එකක් දාන්න 077යි 18යි 46යි 911 077යි 18යි 46යි 911. ඒ වගේම channel එකත් subscribe කරන්න කියලා ආරාධනා කරනවා. කමෙන්ට් කරන්න. අපි යමු පේපර් එකට. මේ කියනවා true or false about the disintegration for tablets. ये प्रकाश है enteric-coated tablet should disintegrate within 90 minutes at pH 6.8 phosphate buffer. False. Effervescent tablets should disintegrate within 5 minutes. False. C. For effervescent tablets, disintegration test is carried out between 15 to 25 degrees centigrade. False. The disintegration test apparatus is recommended to use when the disintegration test is carried out for effervescent tablets. False. The disintegration test gives a measure of safety of a drug. False. The following tablets, excipients and their properties are correctly paired. Lactose, diluent, true. Water, binder, true. Magnesium stearate, lubricant, true. Peppermint oil, flavoring, true. Sodium starch glycolate, disintegrate, true. True or false? The disintegration test is a chemical test. False. Tablet disintegration decreases the effective surface area of the drug. False. C. Tablets friability is decreased by increasing the compaction force. True. The friability test assesses the loss of mass. True. The uniformity of content tests the tablet mass variation. True. True or false regarding drugs used in the treatment of peptic ulcer? Aluminium hydroxide acts by reducing the secretion of gastric acid. False. Omeprazole is known to induce hepatic drug metabolizing enzymes. True. Omeprazole is indicated when a patient is prescribed low-dose aspirin. True. Magnesium hydroxide is known to cause constipation. False. Omeprazole is included in Helicobacter pylori eradication regimes. True. Oral rehydration salt ORS, when correctly reconstituted, is a hyperosmolar solution. False. As glucose 2 principally provide energy. False. Contains potassium chloride. Potassium chloride. False. Contains sodium bicarbonate. False. Should not be given in the presence of vomiting. False. Metoclopramide is a dopamine receptor antagonist. True. Reduces the tone of lower esophageal sphincter, true. Increases peristalsis and emptying of the stomach, true. Is known to cause dystonic reactions, true. Is known to cause gynecomastia, gynecomastia, true. True or false? Omeprazole is included in Helicobacter pylori eradication regimes, true. Metoclopramide is known to cause extrapyramidal side defect, true. Cisapride is recommended in the treatment gastroesophageal reflux in children. True. Loperamide is an opiate analog. True. Antacid act following system absorption. False. True or false about propranolol? It is a beta blocker. True. It increases heart rate. False. It is contraindicated in bronchial asthma. True. It is used for prevention of angina. True. It should be avoided in heart failure. True. True or false regarding antihypersensitive? Verapamil is calcium channel blocker. True. Enalapril is a beta blocker. False. Methyl dopa is recommended for hypertension in pregnancy. True. Propranolol could be used alone in the treatment of mild hypertension. True. Captopril is contraindicated in hypertension during pregnancy. True. හරි අපි බලමු disintegrate test. Disintegrate test. Disintegrate test. Integrate test. Is physical test. Is physical test. Physical test. Measure the level of tablet breakdown. Breakdown in aqueous medium. Is used to test quality for oral dosage forms suppositories pressuries evaluate time requirement for physical breakdown of tablet අපි ඊළඟට බලමු ORS. 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 Oral rehydration. Rehydration therapy. Therapy. Hydration therapy. The administration of the administration of the administration of fluid fluid mouth to prevent or prevent or correct the correct the correct the dehydration 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 that is that is that is a consequence of diarrhea of diarrhea diarrhea oral rehydration solution should enhance the enhance the enhance the absorption of absorption of absorption of water and and electrolytes replace the electrolyte deficient adequately and safely adequately and safely and safely contain and contain alkalizing agent to counter acidosis be sightly sightly hypo osmolar to prevent the possible induction of induction of osmotic diarrhea diarrhea Be simple. Be simple. Be simple. Use in. Use in. Hospital and. Hospital and. At home. At home. Be. Be palatable. Acceptable. Acceptable. Especially to children. Especially to children. Children. ඊළඟ point එක. Be readily available. Be readily available. Available. Glucose in. Glucose in. ORS. ORS. Is not. Is not. Sufficient to. Sufficient to. Provide energy. Provide energy. Energy. If there is severe dehydration. ORS is not sufficient to treat dehydration. Admit for IV 0.9% sodium chloride. Continue. Giving ORS. Until saline is administrator. Patient advice. Patient advice. The large should be dissolved in 1 liter of recently boiled and cooled up to room temperature. Water. The smaller the smaller sachet is dissolved in 200 ml of water. Do not add sugar or salt to preparation. Give 200 ml to 400 ml after each motion. Child up to 200 ml. The remaining solution should be discard after 24 hours. If there is vomiting, give sips of ORS frequently. ORS composition. Sodium chloride. No encourage. Glucose coupled sodium transport which includes absorption of water. KCl replace the potassium lost in the stools. No citrate. Correct. Acidosis. Glucose promotes sodium coupled glucose transport and not for calories, calories. Look for calories. ORS. Reconstitution. Storage. Use. Add all. Contains. And dissolve. In the relevant amount of boiled, cooled water. Avoid adding anything else. Once prepared, use within 24 hours. Discard the balance. Reconstitute fresh after 24 hours. Continue breastfeeding and give other fluid other fluids to correct hypokalemia. Use IV KCA, oral KCA. අපි අද සාකච්ඡා කරේ 10 වෙනි පේපර් එක ඉවර කරේ. පේපර් 10 ඉවර වුණේ. මොනවා හරි ගැටලුවක් තිබුණොත් එහෙම අපේ දෙදෙනාක් තිබුණොත් මට WhatsApp message එකක් දෙන්න. WhatsApp 077යි 18යි 46යි 911ට. channel එක subscribe කරන්න කියලා ආරාධනා කරනවා. subscribe වගේම comment කරන්න like කරන්න කියලා ආරාධනා කරනවා. හැමෝටම සුබ දවසක්. අපි ඊළඟ පේපර් එකේ හමු වෙමු.